So with the lip flip, what we're going to be doing, Miss Melissa is so very nice to be my patient. We're actually going to be injecting a neuromodulator into the upper lip right above the vermilion border. And by doing so, it relaxes, hey guys, it actually relaxes the oris muscle. And when that muscle is relaxed, it allows the lip to actually flip up higher. So it gives you the illusion of fuller lips. A lot of my patients choose to start with that prior to getting fillers if they're nervous about what they would look like with fuller lips. So by doing the lip flip, it's going to allow her lip to flip up a little bit higher and show better. I do have some patients that actually choose to do the lip flip even if they get filler, just to get more of a show.
Okay, so you can do both.
You absolutely can do both.
Okay, great.
The difference between the lip flip and filler is with the lip flip, you're not getting actual volume.
Okay.
You're just getting a higher show of the lip. So ultimately, it's literally just the illusion of a fuller lip.
Okay.
When you get into the filler realm, you're actually getting the volume with it as well.
Okay, that's a great point. So if you have any other specific questions regarding what Brittany was just talking about, of course, everyone's lips are completely different. Our consultations are totally free, and it would be a really good time to come in and talk to Brittany so she can look at you, look at your lips, see the results that you want, and then make her suggestions. Because after all, she is the professional and she knows the best products to use and how much, and what would be the best options for you depending on your results. Everyone really is different.
And if you want to take a close-up of Melissa's lips,
Sure.
She has actually had filler in the past. She started out with very thin lips, so we added some filler, and now she just wants a little bit more show. So the one thing with using the lip flip is it's not immediate. The results take anywhere from 2 to 10 days to kick in versus filler where you do get the immediate gratification.
Okay.
So I'll make sure that we post some after photos so you guys can actually see what the lip looks like once it's flipped up. And it's a super quick procedure. It is a little pinchy, so I go ahead and let my patients know.
You're always very good about that. Always
What
letting
they're
them
gonna
know.
feel.
Yes. And you are using Xeomin, right?
I am.
Okay.
I'm choosing to use Xeomin. There are other alternatives like Botox. There are Dysport, Jeuveau. You can use any of the neuromodulators.
Okay.
But I do like Xeomin. So I'm just going to clean her upper lip, and we're going to be going right above the border.
Okay, great. We love Xeomin at Pura Vida. We love it for multiple purposes, and this is something new and exciting that's been very popular, the lip flip, and we're so excited to do this and be able to show you today. Thank you for being our patient, Melissa.
You're welcome. It can also help with some of the radial lip lines above the lips, or I call them water bottle lines, smoker lines. People name them different things.
Okay.
But I go ahead and have my patient make a pucker. You can see where some of her lines start to form when she puckers. And then I'm going to be injecting right above the vermilion border, which is why it's a little pinchy. Could you smile for me? You can see when she smiles that the side of her lip actually tucks under a little bit. So I'm going to be injecting in those areas to help flip the lip up higher.
Excellent.
So I'm going to go ahead and let my patient know that we're going to do 2 injections on this side and 2 on this side.
Okay.
So we're going to start with the first one. It's going to be right here, little poke, awesome job. And then we're going to do it right here, little poke. So that's
Great.
the first set. You can get little bubbles right above the lip, a little bit of bleeding. That goes away within a few minutes. So I'm just going to hold pressure for just a minute, and then we'll do the other side. And once again, this is a super, super quick procedure.
Okay.
It does not take long whatsoever.
Okay, so if a patient were to schedule this procedure, how much time would we book them on the schedule?
15 minutes.
15 minutes. Excellent. Excellent. 15 minutes plus maybe a 15-minute complimentary consultation too. And yep, that's it.
So I'm going to switch sides, and
You
we're
got
going to do
it.
the other side. Now, do y'all have any questions?
Absolutely. Please speak up if you have any questions. Okay. Please feel free.
So we're going to do the same thing on the other side, and it's going to help this area flip up like this. Ultimately, is going to be the illusion that you get. So we're going to do a little poke here. Good job. and a little poke here. And that is actually all it is to it. So very, very simple, guys. And then in 2 to 10 days, once it activates, that lip is gonna pull up and it will show more pink and give you the illusion of fuller lips. Do we have any questions on the Facebook Live from our viewers?
Any questions on the Facebook Live, you guys please feel free to ask and we can answer them now. Even if our live is over, you can still ask your questions and we will get back to you right away. There's no questions right now. I have a good question. So earlier you mentioned, so a patient who has had lip filler can do the lip flip, or a patient who does not. So it doesn't matter if you've had filler, if you haven't had filler, if you're just wanting to start, kind of break the ice for that first time getting something done with your lips, this is a great place to begin, yes?
Absolutely. And once again, like I said, she has already had filler. She just wants a little bit more of her lip to show. So ultimately, the result that you're going to get once this kicks in is it's going to pull the pink up
Great.
and show more
Beautiful.
lip
Okay.
and give you the illusion of a fuller lip.
We had a question here in the room.
Yes.
Absolutely.
I was just curious how much it cost.
Sure. So for the lip flip, we charge $85 for the lip flip.
Mm-hmm.
And then depending, so with any neuromodulator, it can last anywhere from 3 to 6 months. But the mouth is a more active muscle. We need it to eat, drink, so it can wear off a little bit quicker when it comes to the Oris muscle. Everybody is different. So it just depends.
For those that are here attending in person, the price today is $75 if you were in attendance.
Excellent. Excellent.
Even better. Any other questions?
Any other questions? Okay, if you're attending our Facebook Live and you want to ask more questions after the video, please feel free. You can always call us or text us, 644-8586. We'll tell you more about lip flip and get you scheduled with Brittany for a consultation. And if there's no other questions, we will leave it here. Everybody have a lovely Friday. Thank you, Melissa. Thank you, Brittany.
Thank you.
Thank you to all our attendees.
Bye.
Bye.
Bye.